first and foremost, it is important to know that in pregnancy, both people involved in the pregnancy, the pregnant woman and her partner, may experience hormonal changes. And moodiness, or mood swings up and down or being a little more weepy in pregnancy, can happen to both parties. So sometimes it's not just her. The other thing that is very important is identifying what puts us at perhaps an increased risk for postpartum depression. So just to run through what might put us at risk. First and foremost, if you have ever had a previous history of depression, anxiety, or mood disorders, that might be an indicator. And sometimes things crop up postpartum that we think we have already dealt with. Second, if there is a history of an eating disorder, something that happens more commonly these days in our culture, if there is a history of an eating disorder, this sometimes points to, again, some anxiety, some depression, some control issues that may pop up when we are postpartum. So that would be another identifying factor. Number 3 would be if there is a previous history of sexual abuse. It's important to know that when we are pregnant, as much as we are intelligent and have our act together, we are a little bit in a heightened state of vulnerability. Our body is changing, and for some level of time, we are counting on people to help take care of us in the pregnancy, the labor, and the postpartum time period. And sometimes, if there is a previous history of sexual abuse, these things can come up when we're pregnant as our body is changing, and they can also sometimes come up when we are in labor, feelings of the pain in labor or pressure in labor. So again, important if that has not been addressed through counseling, perhaps to work through it in the pregnancy and get some help around that, giving yourself a little time to process it before you're in postpartum. Another sign of abuse within the context of a relationship would be the behavior of the partner. If the partner is acting very, very controlling or acting very, very jealous, if the pregnant woman finds herself holding back, afraid to do certain things, afraid to talk about certain things because she is afraid of the partner's reaction. So physical signs, emotional signs, and bruises do not have to be part of the equation.